name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing interesting healthcare topics. Today, I'm joined by David Gervais, the manager of NMC's Diagnostic Imaging Department. David joined NMC in 2011 as a full-time nuclear medicine technologist. In 2013, he became the department manager. So today we're going to talk about diagnostic imaging and the role of the department at Northwestern Medical Center. So David, thank you for joining me today to talk about this topic.
It's my pleasure.
Yeah. So let's talk about your background first. So how did you become a manager and what does it take? And you're a technologist too, so talk about that.
Technologist by training, Jill. Graduated in 1998 from the University of Vermont's nuclear medicine program. Began working at the then Fletcher Allen, now University of Vermont Medical Center. Also worked at Dartmouth Hitchcock Medical Center, as well as a small cardiology company here in Vermont. Also have some background on the state level, working as the chair of the Vermont Board of Radiologic Technology for 5 years, as well as a lecturer in the University of Vermont's nuclear medicine program. I came here to NMC in 2011, like you mentioned. I worked in the nuclear medicine department, and the management position became available. Because I had had some previous management experience in my previous work, I decided to go for this, and it's been an adventure ever since.
That's wonderful. I love promotions from within, so that succession planning is great. So diagnostic imaging, it used to be called X-ray, so what is diagnostic imaging?
Well, the traditional term really is radiology. That's what everybody's familiar with. And by definition, the term radiology is basically using X-rays and high energy radiation to do different types of diagnostic exams. And really, the radiology department has expanded so much to include so many different modalities, even ones that don't use high energy radiation, things like ultrasound or MRI, that really the term radiology was a little bit old. And so the term diagnostic imaging is more all-encompassing of those departments that are underneath that umbrella of diagnostic imaging.
Wow, you make it sound so simple.
For me, it is. No.
Okay, so you talked about modalities. So what's a modality? Maybe if you could give some examples of what types of things you actually do in that department.
Absolutely. So a modality is essentially a subsection of diagnostic imaging. So one of those imaging modalities. So while here at NMC, we have all sorts. So X-ray, CAT scan, MRI, ultrasound, echocardiography, nuclear medicine, my pride and joy, mammography, all sorts of those. Those are all termed modalities, or they're subsections of the diagnostic imaging department.
So how do you know when you need one of those? X-ray, ultrasound, CAT scan, is there protocols, or how do you know if you need one of those?
Well, normally your primary care physician will recommend an exam based on his physical exam of you or your symptoms. Something as simple as having a chronic cough could warrant a simple chest X-ray. Now, if that chest X-ray doesn't show anything, or if it does show something, they might want to dive deeper into that particular diagnosis and order a detailed 3D CAT scan of your lungs to see if there's anything deeper in there that they can see that they might not be able to see on a traditional two-dimensional chest X-ray.
Wow, wow. Now, MRI, that's sort of a latest thing, so what might you have an MRI for?
MRI, there's a lot of orthopedic work that we do in MRI, a lot of spine work that we do in that modality. After coming to this department, before I came to NMC, I worked only in cardiology. I was so fascinated by the amount of detail that all these different modalities, all these different imaging areas can actually get of the body. MRI is one of them. It's amazing the amount of detail those MRIs can show of your spine or of your shoulder, even of the wrist. My MRI technologists have to do some pretty fancy legwork to get these people positioned in our MRI, but just even the details of the bones of the wrist is absolutely incredible.
Wow, wow. Now that MRI is larger now, because I know I might be claustrophobic. I've never had an MRI, but ours is a little bit larger now, so it takes away that feeling.
It does. We have such a beautiful imaging suite in MRI. It is a large bore MRI magnet, meaning that there's a little bit more room than a traditional magnet inside the bore of it. It really helps reduce patient anxiety. They feel a little more comfortable, and we have a wonderful ceiling light that actually mimics outdoor sky that helps patients relax as well.
Great, great. So, well, let's talk about your pride and joy, like nuclear medicine. You said that that's your background. So, when do you have a nuclear medicine test? What's that like?
Nuclear medicine, unfortunately, has the unfortunate name, right? If people hear nuclear and then all of a sudden they, am I going to glow in the dark tonight when I go home? Things like that. But nuclear medicine is a very critical component of our department. A large portion of the work we do in nuclear medicine revolves around cardiology. Myocardial perfusion testing or cardiac stress testing is a very large portion of what we would do in nuclear medicine. It provides detailed blood flow imaging for those patients who might be having chronic chest pain or we need to look at the arteries in their heart.
Excellent. Yeah. Now, what type of staff would be in nuclear medicine? What do you have for staffing there?
Yeah. So we have a dedicated nuclear medicine technologist. The training for a nuclear medicine technologist is a little different than a traditional X-ray technologist, a little more in-depth. Most nuclear medicine technologists that graduate from school nowadays have a bachelor's degree, whereas most X-ray technologists come out with an associate's degree.
Okay.
Much more physiologic education because of the molecular imaging portion of nuclear medicine. It's really down that deep.
Wow, wow. So talk about your staff a little bit. What type of staff would you find in the department? Maybe some highlights about your staff, because really they're the essence of the department and the relationships that they have with the patients that come in, because I'm sure people are a little nervous about having a test like that.
Absolutely. Radiation scares everybody.
Yeah.
And what I think that I want to highlight about my staff is every single member of my staff has the knowledge to educate and to help, alleviate those fears of radiation. Everybody in this world is exposed to radiation every day. Just flying in a plane, you get exposed to radiation more than you do being on the ground. And helping people understand the benefit versus the risk of having an exam is something that my staff is excellent at doing. They're so dynamic, they are so energetic, and they're so passionate about what they do, and it really shows. I'm very fortunate. My office is right where we go and pick up patients, right in the waiting area. And every day, day in and day out, I hear them interacting with patients, and I hear the patients come in and say, "Oh, I'm really nervous about this," but they leave saying, "Thank you so much. That was great."
That's really wonderful. That's great. I mean, the staff is, phenomenal, really. You're right.
I think so.
They have so much energy. You're right. Such positive spirit about the work that they're doing.
Absolutely.
So what's coming? What do you see? You got any new equipment, or what might we expect? With all those big equipment, you must have some plan.
Absolutely. So on the horizon, tomosynthesis, a 3D breast imaging for our mammography department, a really critical service we're excited to introduce to the NMC community. An upgrade to our CT scanner, which is going to enable us to do some lung cancer screenings for our community. As well as we're going to be introducing a state-of-the-art gold standard bone density table in our department, so that we can get those the National Osteoporosis Foundation recommends a table bone density versus other types of bone density that's available. So we're going to be able to offer that service to our community as well soon.
Excellent. That's great. Now, bone density. So why would I need bone density scanning, or what's that for?
Well, as we age, we lose the mineral deposits in our bones, and bone density imaging is one of those ways that we can assess that. Women or men as they age, as I said, do lose their bone mineral density, and when we can assess that, a physician or a provider can actually treat that and reduce the risk of hip fractures or fractures in general as we age.
Great. Now, are you only located in the hospital, or do you have other sites?
We have a lot of tentacles out there in the community. So we have imaging available, X-ray available in our urgent care centers, both in St. Albans and in Georgia. We have ultrasound available in our OB/GYN office right on the campus, as well as two-dimensional mammography available in Georgia on a walk-in basis, which is very convenient for patients.
Absolutely. So talk about your radiologists. Are they right in the department, and how has their practice changed or evolved?
We have two dedicated radiologists hopefully soon to be 3, that work right in the department, performing procedures with our patients, as well as reading all of the imaging procedures that we do day in and day out. They're a very dynamic group, very, very professional, certainly very competent in what they do. It's a pleasure to work with them, and I really enjoy working with them as a team member.
Yeah. You know, I was reading a patient satisfaction feedback, and it's great to start seeing patients saying, my radiologist came out and talked to me right after the exam. So I could see that, you know, even in the words, that reassurance and that, you know, feeling like that sigh of relief that they came right out and talked to them, and it was very comforting for them. So that's really a nice advancement for the patient experience.
Absolutely. And even though it can't be done every single time, there are those cases where our radiologist will certainly take the time to come out and speak with a patient about a critical result, something that they were urged to come in for urgently. Make sure we reassure them that if they did have a positive, what the next steps are, or if it was negative, reassure them that it is indeed negative and that they can go about their daily business and not worry.
Sure, that's great. Another thing I've noticed in your department is some students. So what role do your staff play in student education and learning?
We're very fortunate to have Champlain College X-ray students come and join us even through the summer months. I was pleasantly surprised at the competency of the Champlain College students in our department. They are always top-notch. They perform procedures right alongside our clinical instructors. We have X-ray technologists who have been certified by the college to become clinical instructors and help guide these students through their education. I very often hear them say how much they love to come to NMC with the small size, the family feel that we always talk about, and how much they love it.
Great, thank you. Well, we're running out of time, but tell us what you do for fun. Sounds like you got a busy job. What do you do for fun?
Well, I love to travel. I certainly love to travel, spend time with my friends and family, and as I think you know, I love to sing.
Yes.
So
Yes.
really just anything that's out of doors, you know, with friends and family is what I do a lot. And travel, I got a taste of the Caribbean recently. Unfortunately, I think I got bit by that bug, so I'm going to be going back there soon.
Good for you. Well, it's all about balance, isn't it?
Absolutely.
Yeah. Well, David, thank you so much. It's been a very interesting topic, and I think you've shared a lot of great information about diagnostic imaging. So thank you for being here today.
Been my pleasure. Thank you, Jill.
Yes. This is Jill Berry Bowen, your host of the NMC Health Beat Show. Thank you so much for joining us today.